Good evening, everybody. Thank you for tuning in again or catching this on either Facebook, YouTube, or Twitter. My name is Dr. Stephen Walker. I'm a licensed psychologist. I'm doing mental health live streams every Monday, Wednesday, and Friday to try to normalize conversations about mental health and mental illness. Because again, I start every show with this. Everyone has a degree of mental illness. Everyone has a degree of physical illness, but not enough people are working on it. So this is my attempt, small little attempt in the millions of people on social media to try to normalize conversations about mental health and mental illness. We're going to be talking about how to handle holiday depression and anxiety. This is the second part. We did a first part. We had really good interactions with people, so I wasn't able to get too deeply into some of the interventions and things, but that's great because again, remember, this isn't about me just talking. When I decided to do this and my wife and I were discussing doing this, I did not just want to be somebody out there just talking. I wanted interaction from people watching. I wanted questions. I want people to get into the habit of talking about your mental illness because we all have a degree of mental illness, myself included, everybody. Okay, mental illness is on a spectrum. So before we get into, had a couple of good questions and comments coming in after the show on Friday, but I'm sorry, on Monday. So we have coming back Friday night, Dr. Nick Fortino. He's a professor and he's a psychology professor at a major university on the West Coast. And he's going to be talking about stress. He's going to be talking about, hey, Samantha, how are you? He's going to be talking about how to the good parts of it, the bad parts of it, how to manage it, how to deal with it. He's going to be giving us he's more research based, so he's going to be giving that perspective on that. So please tune in Monday night. He's going to be on again. He was on a few weeks ago, and we had a really good exchange. So please tune in Friday night for Dr. Nick Fortino. So let me get into a couple of questions. Samantha, hey Samantha. So Samantha had asked me a question after the last broadcast, and she made some really good observations that mental illness is universal, that we all have a degree of that. So that was obviously spot on with the message I'm trying to impart. But she asked me a question that I wanted to get to about, let me see here. Now, of course, I had it queued up and it's gone. So I don't know, Samantha, if you decided to take that down. So I'll just move on to the next person. Oh, here it is. Is it wrong not to want to gift relatives that have nothing to do with you? Great question. Okay, great question. Hey, Fernando, how you doing? Hey, Angie, how are you? Thanks for coming back. Again, Fernando, thanks for all that good exchange on Monday night's show. That was awesome. Angie, hope all's well. I got your messages today. I will try to respond to them. So no, I mean, if you're asking me for kind of advice from just a kind of life coach perspective, is it wrong to want to gift relatives that have nothing to do with you? If they have nothing to do with you and they're not giving you gifts, it's not wrong. If you want to give them gifts and that helps you feel like you're giving to family members, then it's not wrong either. The decision really, Samantha, is yours because you've got to do, and I encourage a lot of my client patients to, when they have to make decisions, I always encourage them to think about, make a decision that you can live with. Do what you can live with once you do it. So if you're going to regret doing it, then don't do it. If you're going to look at it like, oh, everyone's using me again, and that's going to set off a whole bunch of negative feelings in you, then don't do it. But, I have some non-traditional views of family in the sense that their parents expect it. Well, again, Samantha, you have to decide whether or not you want to be responsible for the expectations of other people. So if you think it's going to cause more of a problem to not do it than to do it, then you've got to follow your intuition on that, and you have to follow what you think is a good idea in that respect. I try not to, I know a lot of mental health people, some licensed, some not, they like giving advice and they like telling people what to do. All that does is create dependency. That's not the way I try to help people. I try to engender their ability, their own healing ability, their own ability to make a decision about what's right for them. So Samantha, she's saying, I promised 2 dead sisters I would take care of their grandkids. Now I regret agreeing. Well, that's difficult. So you're dealing with the loss of 2 dead sisters that you promised to take care of their grandkids. Now you regret agreeing. I would ask you, why do you regret agreeing? Are the grandkids just, spoiled or pains in the, what? It sounds to me like there's some guilt going on here, like you feel indebted to or that you want to live up to your promise to your dead sisters. So I would say, if it's going to cause you personally more negative, dysphoric feelings, like depressed feelings that you're not doing it, then do it. Then just do it. Buy them a token gift and know you've lived up to your promise. But do what you can live with, sister. If you can't live with not doing it, meaning after the fact you don't do it, then you're going to be lamenting and regretting it. Then I would say do what's right for you. Take the grandkids out of the equation. Take, even, not to sound mean, but take your sisters out of the equation and do what's right for you. If you regret doing it and it causes you to feel bad about yourself, people, sometimes we got to put ourselves on the front burner. And I'm not saying be a narcissist and not care about people, because not caring is not healthy. I know the I don't give 2 F's and I don't have any F's to give, and all of that is the new craze. It's the worst possible thing we can be going down as a culture, to move more and more into not caring. Not caring is associated with multiple mental illnesses. Okay. Now, I'm not saying just care for, and not, but in this case, Samantha, I would do what's right for you. I would have a talk with Samantha in your mind and do what's right for you, sister. Okay. So thanks for your question. And let me get to somebody else here. Let me get to this one. This was a really good one by a viewer. She asked me not to, well, I said I wouldn't use her name. So, but hey, I know you're going on live tonight and just wanted to ask a question before you go on live. My mother had an affair and had 2 kids by this man that is now my biological father. I grew up not knowing he was my father. My mother got a divorce from her husband that I call my dad. My dad was homeless after the divorce and still is homeless today. He says it's a lifestyle, but that's a different story. Anyways, what's been on my mind lately is that I don't have a relationship with my biological dad. I've met him a couple times and he was willing to meet me every time. I found out he is a sex offender from child enticement. I'm torn between wanting a relationship with him or keeping my distance from him for my safety. Great. This is a perfect idea of, you're welcome, Samantha. Hope that helped. This is a perfect example of, I'm just going to refer to the person as JM, that JM is dealing with, because this is a multi-layered issue of her mother having an affair with the person who is now her biological father, finding out, who's her dad, growing up with all this indecision or not knowing once she found out. Now come to find out that her biological dad has some sex offense charge against him and she doesn't know what to do about that. So Jam, what I would recommend that you think about in a case like this is kind of similar to what I was talking to Samantha about. You've got to get into like why you want to have a relationship with this person. Now, I know it's obvious, he's my biological dad, but what I mean by that is what is going on within you that hasn't been met by meaning that your relationship with your biological dad is important. I'm not saying that, but there's something missing within you that you're hoping he will fill. Now, the reason I'm saying that is there's a good chance he may not be able to fill it. So the reason I'm pointing that out in the onset is you've got to know that going into it. You've got to know that it's going to be difficult for him to fill whatever missing father piece you have. Now, does that mean don't do it? No, absolutely not. What I would encourage you to do is talk to him. I don't know if he knows, if you know that he has this sex offense charge, but talk to him about it. Don't bring your children, obviously, until you feel comfortable, but talk to him about it. Say, look, this is how I'm feeling. Like you said to me before, You could say to him, I'm torn between wanting a relationship with you or keeping my distance. Talk to him about it. Get into it with him. It sounds like you're more leaning on the side of having a relationship with him. What I would recommend, of course, is if you have a relationship with him, find out what is going on with the sex offending charges. You said child enticement. That could be a misunderstanding. That could be the only time he's been caught. That could be a myriad of things. But I would just call it out in the open and talk about what you're concerned with. And if you do move forward with this, monitor your children. Don't leave your children alone with him until you feel comfortable or until you guys have worked out some protocols, or not at all. I've worked with sex offenders. I've worked with female sex offenders in an institution. I've worked with male sex offenders in a treatment program. There's a whole constellation of psychological forces that are at work within a sex offender. And some people would say, "Oh, well, if you're going to molest children, you're just a lost case, and you should be shot and all that." And I get that. Even criminals in prison. I've worked in multiple prisons. People who are sex offenders are literally the low person on the totem pole. So, but what I would recommend, JM, is that you need to have a discussion with him about your concerns. Okay. You need to have a conversation, a matter of fact, adult conversation with him about your concerns about having a relationship with him. And then you have to have a conversation with yourself about what your expectations are for having a relationship with him. Because a lot of people go into these reunions with long lost parents expecting that it's going to be, whatever, only to be very disappointed. Not always, but I'm just saying that you want to go into it with that kind of mindset. Okay. So I hope that helped. Feel free to shoot me some additional questions. Again, guys, if you're watching this after we've uploaded it, please feel free to comment. I try to get to as many questions as I can, because mental illness is something everybody struggles with. Okay. There's not a person on this planet who does not have a degree of mental illness. Okay. Last one I'm going to get to right now is from Marie. I've been dealing with anxiety and depression for my entire life. She's 65 now, and it's finally causing me to isolate, not eat, feel nothing at holidays, can't deal with driving, et cetera, et cetera. When does it become clinical? Well, sister, it's clinical. Okay, because what you're talking about is, now remember, there are degrees of clinical impairment. But yes, and Samantha's saying, trust your gut. Yes. Marie, you're already in the clinical range, because what you're talking about is clinical. See, the thing about actually having a disorder, everyone likes to throw around this disorder, but they don't realize that there's certain benchmarks and specifiers and criteria you need to meet in order to have a disorder, a full-fledged disorder. You're describing, and just going going from your question, Marie, you're describing what's called clinically significant impairment or distress. So what that means is you are already experiencing a level of impairment that would cause me to say that you have some form of clinical depression. Now, you're saying you've had anxiety and depression your whole life. And if anyone's ever tuned into the show, my sales pitch is not to work with me, because like I said before, thankfully I have enough people to work with, but find a licensed mental health person and talk these things out. Work on it. Marie, I don't know you. I've never met you. I've never spoken to you personally, but clearly there is some form of trauma that you have not dealt with. Okay. Some anxiety or depression your entire life. That leads me to believe that there's been a compounding of years and years and years of not working on it. Okay. That is something you need to work on, sister, because the fact that it's still affecting you at 65, and now you're isolating, you're not eating, you don't feel anything at holidays, you can't deal with driving because of fear, probably. When you have to start working on that. And I know people will say, and I'm not, you can't, people don't change, or you can't teach, I don't want to say dog because she's a female and I don't want to make the association, but everyone knows that expression. You can't teach an old dog new tricks. That's nonsense. That's nonsense. We are not dogs. We are not animals. Okay, people like to say, oh, we're basically animals. And that's true to a degree. But show me an animal who can do the stuff human beings can do. We can always heal. Everyone can learn. Everyone has the capacity to learn. And people will say, well, people don't change. And it's so funny. And I posted this years ago. Ain't it funny how the people who say people don't change are the ones who never change? They're the ones who don't change. Everyone can change. Everyone can learn. You cannot learn without changing, and you cannot change without learning. If you replace the word change with learn, now what moron, is going to say people don't learn? Of course we can learn, people. Of course we can learn. So Marie, if you're on live now tonight, or if you're catching this after the fact, please work on whatever's causing you the anxiety and depression, okay? Because the fact that it hasn't healed yet is because you haven't worked on it, okay? So let's get to the topic tonight. Again, anybody who's watching, please feel free to chime in. So how to handle depression and anxiety. The main way to handle depression and anxiety, one of the ways to handle depression and anxiety, specifically from the holidays and seasonal depression and anxiety, is to admit that you're feeling down. Hey, Penny, how are you? So true. What's so true? Please follow up on that. We need to admit to ourselves, I'm depressed, I'm down. And the problem with that is people don't like to admit, not only to themselves, but to other people around them, that they're hurting, that they're feeling pain, because they don't want to be a burden. They think people are looking at them like, oh God, whatever. You got to admit to yourself that you're experiencing negative emotions in order to deal with it. You have to. You can't deny that you're feeling down. That's why everybody or people who have watched these live streams know I call it the it's okay pill. The it's okay pill is you saying to yourself, it's okay that I'm down. It's okay. Now, once you make it okay, then you can deal with it. The last part one of this show was about what I've heard before, experience in my own life, when you're not that close with your family. Those are people who it's fragmented, it's not that close. There are many reasons for that. They go through all kinds of negativity, guilt, feelings of isolation, feeling that there's something wrong with them, okay? Tonight, I'm going to take a different topic. I'm going to talk about people who get down and depressed or anxious, have a family, but feel isolated, feel alone, feel like they can't connect with them, okay? So, and again, remember, guys, as you're watching this, please ask a question or make a comment. I start with a topic, but the live streams will end when people are just sitting there listening to me. I appreciate the fact that you guys respect my training, my experience, my knowledge base. I get that, but this isn't just about me talking. This is about you guys interacting with me to ask a question about what's going on, okay? Penny's saying your take on being okay. Exactly, Penny, because what I found in doing this work is that people hate how they feel. They don't like to admit that they're down. They don't like to admit that they have negative feelings. Why? Because we have this nonsense let it go culture, this idea that we should let go of how we're feeling. I was working with a gentleman today, and he was talking about, I don't know, some symposium or something he went to where he tried to ask the person a question about some pain, and the person immediately got him off all of that and wanted him to focus on his potential and all of this. And why? Because that's what these self-helpers do. That's what people who are not trained in mental health will do. They no offense, but they don't have the ability or the training or the experience to work with negative emotions. So what do? They're all sort of have this different take on be your best self, let it go, focus on the positive, live your authentic self, and all the other cliches. Now, I'm not saying that's not important. I'm not saying that you should disregard that. But the majority of people on this planet have unhealed emotional wounds. They are not dealing with how they are feeling. And yes, it rhymes. You've got to deal with how you feel. You've got to say to yourself, it's okay that I'm feeling this way. And then you got to work on it. So the example, you're close to your family, but you're still down. You still feel depressed. You don't want to deal with them. You don't want to see them. Okay. So Fernando's asking a question. It's especially hard during holidays to admit you're down when people expect you to be cheery. Spot on, brother. Spot on. Because what happens is you feel that you are the only person. And the question that I was asked before about, the person who wants to reunify with a biological dad, but the biological dad has issues and all that. And I said to her before I came on, you're not alone. These issues within families and these issues of sexual abuse or whatever are rampant throughout our society. Fernando's point about it's especially hard during holidays to admit you're down when people expect you to be cheery. You are not alone with that. That's how everyone's feeling. So what would I recommend? If you're down, but you have a big family, be open with that. Maybe not to the extent where you're launching that off in the family as everyone's together, but telling yourself it's okay that I feel that way because I'm probably not alone. Then I would ask the person who is down by going to their family, what's going on? Like, why are you down? Are there things that your family hasn't dealt with? Are there things about okay, Samantha, yes, thank you. Are there things within your family that you're not dealing with? The main thing about depression and anxiety, people, is as a society, we need to get to a point where we're dealing with depression and anxiety the way we deal with the flu, COVID-19, whatever physical illness we have. We need to get to a point where we're dealing with that like we do with any other physical illness. Why? Because physical illness a lot of times is exacerbated by our mental state. Now, this is something that is just finally beginning to get some attention, that how we think and feel can affect how things function in our body. That is something that people are just beginning to get a handle on. The feelings we have during holidays, the holiday depression, the seasonal depression, a lot of times that's because we, like Fernando said, we're almost forcing ourselves to feel things that we don't really want to feel because we're not really able to get into that spirit for whatever reason. Like we're supposed to be all cheery, like Fernando said. So let me just get to Angie saying, where's their first question? But I'm embarrassed and ashamed that I'm struggling like this, depression in regards to my family. So Angie, again, why be embarrassed and ashamed? Why would you be ashamed of struggling with the flu, with a cold, with cancer? I mean, I know there's a certain degree of shame that people with chronic illness feel, but that's a different type of shame. The shame people with mental illness feel. And when I say mental illness, let me qualify what I mean by that. Mental illness is on a spectrum. Okay. There are degrees of mental illness, just like there are degrees of physical illness. So just like there's a cold, there are degrees of physical illness. So with mental illness, things that cause you to experience prolonged or even moderate amounts of sadness, fear, pain from your past, things like that are associated with mental illness because mental illness has a broad spectrum of different types of specific mental illnesses. So when I'm talking about a mental illness, I'm talking about things that make you feel kind of sick. I mean, kind of down, like you feel when you're feeling physically ill. You know what a physical illness feels like. It's the same thing with mental illness. You feel kind of like, oh man, do you feel pain? You can feel body pain. You can feel just lethargy. You don't want to eat. You don't want to interact with people. Those are all degrees of mental illness. So getting back to Angie's question, Angie, you don't need to add negativity to the negativity by saying to yourself you should be embarrassed and ashamed about how you feel. There's nothing wrong with how you feel. When I say that, I'm not necessarily saying to say that to people, but I'm saying to reinforce to yourself that there's nothing wrong with how you feel. Because as Angie and I have exchanged some messages and spoken, a lot of it is based on early childhood trauma. There's early childhood trauma that a lot of people haven't dealt with. So what happens? That early childhood trauma gets worse and worse and worse. And the next thing you know, you're feeling mentally ill to a degree where you don't want to eat, you don't want to get out of the house. So Angie, what I would encourage you to do, as we've talked about, is continue working on it. Continue finding a way to talk it out with somebody who can process it with you in a judgment-free environment so that you can feel as though you're getting that part of your soul, psyche, mentality, emotionality, whatever you want to call it, healed. Okay. So Angie's saying, all my life, I've always been okay, even when I'm not. I've always been okay when I'm not. No matter what happens, I'm the one who continues to present that I'm okay, that others can talk to about their issues. Right. So now, what am I hearing here? Now, Angie's talking about a different form of when I say it's okay. Angie's saying that she hasn't felt okay, but she hasn't told or let on that she doesn't feel okay because she doesn't want people to think, oh, wow, you're not okay. So if you're not okay, then who can I count on? But Angie, the question I would ask you is, why do you need to pretend that you're okay when you're not okay so that other people can talk about their issues? Like, why is that? What are you personally getting out of that? Is it a thing where you're afraid that if you share with people who are coming to you to talk about their problems, that they're going to not want to talk to you? Are you afraid that you're not going to get the acceptance? Like that's what I would want to get into a little bit. But Angie, I think it's time to admit to yourself and to people around you that you're not really feeling that okay. You've got some issues and you're going to work on them. Because specific to holiday depression and anxiety, guys, I'm not saying everybody, because that's a pretty broad-based way of looking at it, but a lot of people struggle with this because, like I said, on the part one, there are people who are estranged from their family. They're distant from their family, so they feel that guilt. There are people who have a close family, but feel this anxiety, depression, and then they beat themselves up. They feel like, what's wrong with me? I have this, I have that. There's so many people worse off than me. I shouldn't feel this way. Nonsense. You are entitled to how you feel. Okay. So one of the main interventions I would encourage people to work on, and I'm sure you've seen it in different forms of this, is what are you saying to yourself? Your self-talk. How are you treating yourself? If you had a friend who was down during the holidays and they came to you and said, hey man, or hey woman, I'm feeling down, what would you say to them? You certainly wouldn't say, oh man, dude, what's the matter with you? You got everything in order. And if you would say that, don't say that, because that's going to make it worse. But that's what we say to ourselves. We talk to ourselves and we treat ourselves in a way that we would never, ever talk to a lot of people. Okay. Or we talk to ourselves the way we would talk to our worst enemy. And that's why it's called being your worst enemy. So one of the ways to manage holiday seasonal depression and anxiety, start working on being your best friend. And I just know that sounds hokey. If you can't be your best friend, work on being your best ally. Work on allying with yourself. Step one, it's okay how I feel, man. It's okay. I'm down. It's okay. Maybe I really don't like my family. Maybe they like me, or maybe I'm just not into this whole Christmas holiday buying, whatever it may be. But you've got to work on why you're down. You've got to think about that. I know we don't live in that kind of culture. We don't live in a culture where people are allow themselves to think about what they're down about. But if you have a close family and you're down or depressed about seeing them or being around them, try to figure out what is going on with you. Try to get into that thinking. And people will say, well, I don't want to dwell on that. I don't want to think. I don't want to. The problem is, people, most of the time, people are feeling what they're feeling because they're not thinking about it. They're not allowing themselves to feel it. So let me just get to a couple comments here. Samantha saying, Angie, normal is setting on the washing machine. No one is normal. Good. A huge percentage of our population suffer, but the stigma is too strong. That's not too strong, Samantha, with all due respect. It's only strong because people allow it to be strong and people aren't questioning it. So what I would encourage everyone to start doing is realizing that there's nothing wrong with feeling down. Okay, love yourself enough to get past the stigma, yes, but loving yourself takes work, people. Remember, a lot of people don't even know themselves. A lot of people have no idea why they are the way they are. So loving yourself is a lot, that's the fruit of the tree. So Fernando's saying, I wonder how much money plays a role in seasonal depression. Amen. What do you mean by that? Like people who think they need to buy gifts to make people happy. Well, that's what you mean. Nice. Lots of unemployment out there because of COVID. Absolutely. Absolutely. Amen. Spot on. Money, this need to buy things for people, this idea like I think Samantha was talking about earlier about having to give gifts that she may or may not want to give. That's a whole nother thing. If that's part of what's getting you down, say to people, hey, look, you don't have to give me anything. I'm not in a position to buy people anything. You know what my gift to you is this year? Me. I will be there and we can spend some time together. And I know in this materialistic, capitalistic, consumeristic, I know that's not a word, but it should be, in society, we've lost the ability to just feel the important things. Hey, Alexander, how you doing, brother? Thanks for logging on. We've lost that ability, and holidays will peak that out. I tend to, if you can't tell already, I used to be, yes, I can hear you. Thank you. Well, I can see your post. So ask a question. We're talking about how to handle holiday seasonal depression and anxiety. So you don't want to be part of the commercialism craziness? Don't. Tell your family that. Tell your Alexander's asking me, am I a communist? So, Alexander, if you want to ask a question that isn't ridiculous, feel free. Do you know what a communist is? No, of course I'm not a communist, but I'm certainly not some rabid consumer capitalist who feels that buying things is the way to make each other happy. So Samantha says, I just closed my checkbook. So what I would recommend if you're down, like Fernando said about the money and the role in seasonal depression, talk to people about it. Look, I don't have a lot of money right now. I don't have a lot of, so I recommend we $5 gifts, and those people who can't afford or don't want to buy a gift, don't buy a gift. But the holiday, the seasonal depression and anxiety is so multifaceted and has so many different variables to it, because there are people who are depressed and anxious who are living abroad or can't get close to their family. How do you manage that? The main way, again, is back to the it's okay pill. It's okay that I miss my family. It's okay. And then you have to work on bringing in some optimism into your particular situation. So let's say you're abroad, or let's say you have to work and you can't get to your family, or let's say, like a lot of people, because of COVID, you can't visit the family you love. And my wife and I were discussing this the other day about how COVID has impacted our life. And she was asking me, well, how come you don't seem too bummed out about it all? Well, first off, I was sick as a dog most of March and April. And back then they weren't testing. So 2 emergency room visits and all that. So that reshaped my perspective on multiple levels. But I also have just accepted the reality of things, meaning I've accepted that thankfully COVID isn't the Spanish flu. COVID isn't some plague like Ebola, that we don't have a 10, 20, 30. Imagine if we had a 10, 20, 30% mortality rate. Imagine that. Imagine if 20 to 30% of the people who got COVID died. It would be catastrophic. So I try to put things in perspective, and I try to remind myself that in this moment, things aren't good. But by accepting it and working to balance it out, so again, bringing back in, let's say I'm the person who's depressed that I can't go visit my family, I work on accepting that. I work on it, and that's a whole nother show, how to accept things. But the basic way is you work on talking to yourself in a way that brings optimism to the moment, and you're able to say to yourself, there's a chance things might be better next year. There's a chance I will be able to see my family next year. What am I learning from this? What is COVID teaching me? Maybe I take things for granted too much. Maybe I don't know how important I haven't appreciated my family enough. Alexander saying, wow. I don't know what you're saying wow about, man. But again, if you want to clarify and ask a question, feel free. Asking me if I'm a communist is obviously, you're making a judgment about me without even knowing who I am. So, but again, guys, these are live. You come at me in a certain way, I'm going to come at you back. If you come at me in a way that we can have a conversation, feel free. So acceptance is one of the things that will help people feel some peace. I have to accept that this year, everything is messed up. Everything is messed up. Now, where do I get my hope? Not, oh, pie in the sky, everything's going to be great. I'm not talking about that's that BS social media mental health where you just focus on the positive, everything's great. No, you accept the negative, you work on it. This is what Dr. Fortino and I, Nick Fortino, are going to be talking about Friday night with stress, how to maximize the benefits of stress in some ways, because yes, there are positive things about stress and negative emotion, and how to minimize the negative. So if you can't be with your family that you want to be, you have to accept that you can't. You have to work on accepting that you can't. Hating that you can is going to make you feel worse. Putting your family in a potentially deadly situation where you could infect them is certainly going to make things worse. So let me just get to a comment here. Angie is saying, I'm afraid that they will believe that if I talk about, that if I talk about my issues, then they feel like I'm trying to get attention, trying to make my issues a priority over theirs. Kind of like I don't. Well, you try very hard not to put my issues on my kids. I hear you. I don't put them on my siblings. I'm supposed to be the strong one, the one who protects and cares for others. And I really want someone who will take care of and protect me. So yeah, probably a very lot of stuff from childhood. Absolutely. And Angie, that's the beginning phases of you beginning to understand why you are the way you are. And that is exactly what I'm talking about. You've got to say to yourself first, it's okay that I want to be taken care of. It's okay that I need help. It's okay that I want someone to help me. And you can say exactly what you said to me in the first part of this question to somebody. I don't want you to feel like I'm trying to get attention, and I don't want you to feel that I'm putting my issues over yours, but I'd like the chance to vent to you. I'd like the chance to get some help from you. And yes, if you're realizing that your childhood is affecting your ability to get help, that's something to work on, because clearly that childhood is still pumping out whatever trauma that is pumping out infection in you. So thank you for that. And I'm going to get back with you, Angie, after tomorrow at some point. But we need to work on those traumatic wounds that are causing us to feel the way we feel. Okay. We, like Samantha's saying, we have issues, but the sky is not falling. Yes, that's optimism. But the problem is, Samantha, is a lot of people grow up in such a pessimistic environment that they default to the pessimism, that not only is the sky going to fall, but once the sky falls, it's catastrophic. There's no recovery. The sky will lift, and there's no post-traumatic growth. It's always post-traumatic stress. So let me see here. Alexander is chiming back in. What's going on? Here we go. When the things are coming bad, not like I hope, I feel very bad. I get a lot of anxiety and I try to solve it by eating. Well, Alexander, thank you. That's a comment that we can talk about. So when you feel that things are coming bad, what do you mean by that? Like when things begin to go bad, that negativity affects you internally and you start feeling bad, and then you start feeding into that. So you start feeling bad and you get anxious about the fact that they're getting bad and they're going to get bad. Like Samantha said, you've got that sort of sky falling idea that you feel that things are never going to get better. And eating definitely will temporarily solve that, because what eating does, many people may not know this, but when you eat a lot of food and it goes into your stomach, not only do you feel, satiated and better because you've eaten, maybe it's something you enjoy, but serotonin is released in your belly. That's part of the digestive not in your belly, but serotonin is released in your brain, and that's part of what happens when we eat. So we're flooding our cells with serotonin, which is a feel-good chemical neurotransmitter, and then that causes you to eat more and more. Then as that wanes and you start feeling bad again, you need to eat again. It sounds like, Alexander, you've got a degree, I don't know how much, but you've got a degree of food addiction or eating addiction or eating disorder, not disorder in the sense, I don't know if you're bulimic or overweight or whatever, but you've got to get into, Alexander, what is going on, brother, with your optimism, meaning that it sounds like you have a very pessimistic way of looking at things, like you don't have any hope, like you said. When things go bad, people, one of the things that will affect us, and this is tied into the holiday depression and anxiety, is we get into this idea that, oh God, it's never going to get better. This is just the beginning of the end. Oh, I can't handle this. I don't want to deal with this. I don't want to deal with this. I can't handle this. And this is what makes the situation worse. What makes the situation worse is the way you're framing how you're feeling. Now, a lot of people might not know what framing is. So real quick, like if you think about a picture frame, whatever frame that you have around what you're thinking and feeling will affect what you're thinking and feeling. Like if I have my diplomas on the wall and they're just tacked up there as a piece of paper, they're going to look one way. If I go out and spend some money on a frame, now they look different. Same piece of paper, different frame. Alexander, my brother, you've got to work on, and I'm assuming you're a guy, Alexander can be a female name too, so I apologize if you're a female, but Alexander, you've got to work on how you're framing things when they're starting to come bad, when they're starting to go bad. Okay. Yes, exactly. That's right. It's like a circle. Exactly. It feeds on itself. Exactly. Then what you're saying starts making that circle deepen into more and more negativity. So one of the things I would encourage people who are trying to handle holiday depression, seasonal depression, anxiety, is how are you framing the holidays? What's the meaning behind what you're giving the holidays? So remember, if we talk about cognitive behavioral psychology, my cognitions affect my behavior. If I hate what I do in the mental health field, I'm not going to be on, doing these live streams. I'm not going to see the amount of patients I do. I'm going to probably go back to doing something else. But because I genuinely enjoy trying to help people heal and work through these negative things, I have a lot of energy to do this. So part of cognitive behavioral psychology is the ABCs of thinking. It's an acronym, ABCs of thinking: activating event, belief, consequence. Something activates us, we impose a belief upon that activating event, and those beliefs have consequences in the form of feelings. So let's take the seasonal and holiday depression and anxiety. The seasons come around. That's an activating event. Oh God. Oh man, this is going to suck. Or I hate the seasons, or for whatever reason, justifiable reason you're feeling, that's a belief that you're imposing upon I'm supposed, like Fernando said, I'm supposed to be cheery. I'm supposed to be up. I'm supposed to be, what's that movie? It's a Wonderful Life, where it's a great movie, but I mean, okay. If you're no problem, Alexander. Sorry, I got a little defensive there with the communist thing, but I sometimes get people who come on here and troll, and they post things on, my ads that I'm trying to get people to tune into the broadcast. So I apologize if I came off to you like that. But so yes, Alexander, I'm sorry, I got off track there. Yeah, the belief we put upon the holidays will affect how the holidays feel to us. Okay, yes, the beliefs we impose upon the holidays will affect how the holidays feel. So if we have obviously, oh great, holiday family, they're sitting around the table and blah, blah, then that's how we're going to feel. But if you have a negative belief system about the holidays, and that's going to affect how you feel. Back to square one, work on it. Okay, people? So Alexander, I hope that helped. You got to get into the eating though, bro, because I don't know how old you are. I don't know where your weight is at, or I don't know what's going on with you at all. But if you're eating every time things are coming bad, and then you feel bad because your hope goes in the toilet, and then the only way you can deal with the anxiety is by eating, that's a circle, dude, that you need to break. So what I would start encouraging you to do is say to yourself, maybe tonight, look, it's okay that I've got this circle thing going. It's okay that I've got this thing about dealing with negative things, but I got to get into that. And one of the things that I would ask you to do, Alexander, is figure out, where did you learn that when things start going bad, you feel bad, and then you get a lot of anxiety, and then you need to eat? Like, where did you learn that? Did you not have a father or somebody growing up who told you things like, all right, bro, it's okay, pal, things are going to go bad. They'll go bad and they'll get good. And, maybe you can learn from them. You got to get into where you develop this pessimistic view of when things go bad. Okay. And I've mentioned this book before. I have it somewhere on my bookshelf, but it's called Learned Optimism. It's written by Martin Seligman. He's a father of positive psychology. He's a psychologist. He's a professional. He's a professor at the University of Pennsylvania. Great book. It's called Learned Optimism. It's all about how we basically need to learn optimism, but it also talks about how we learn to be pessimistic. And I did a part of a live stream a few months ago where I was talking about, a lot of people will say, well, dude, I'm not being pessimistic, I'm being realistic, as though pessimism is the only form of realism. Like optimism is like, oh, you're just being an idiot. You're just assuming that everything's going to be great. That's not optimism, people. Optimism is not burying your head in the sand and acting like everything's great. That's social media mental health. Social media mental health will tell you, oh, come on, focus on the positive. Don't give into the negative. Just avert yourself, avert your eyes. Oh, you have only surround yourself with positive, happy people. Such a load of garbage. I'm sorry. It's such the disinformation that people who brand themselves as mental health practitioners. I had a client today. I'm not going to say male or female. I'm just going to say I had a patient client today who was talking about the experience this person had, which just had a major traumatic event happen where there was a bookshelf that fell on the person's head, and the person had a concussion and blah, blah, blah. And so this neurologist, no training in mental illness, just starts laying into her with all these mental health diagnosing with absolutely zero idea of what this person's talking about. And I'm so tempted to call up that doctor tomorrow and give them a piece of my mind, but probably not going to do it because nothing good will come out of it. But all I'm saying is, people who are not trained in mental health need to stop giving mental health advice to people. Okay, why do I say that? Because mental health and being able to work with the mentality of people takes training and experience. And if your only attitude when I was speaking to the person, I was saying, well, okay, well, when they gave you that assessment of whatever their assessment was, did they tell you how to handle it? Did they say, oh, come back tomorrow and we'll work on it? No, it was this untrained physician trying to be whatever. I'm going to give the doctor the benefit of the doubt that he was trying to help, but the effect it had on this person, my client patient, was not good at all. Left the person who just had a TBI, a traumatic brain injury, a near-death concussion, feeling bad about themselves. So Okay, people, the next time you're in a situation where somebody is offering unsolicited mental health advice, please stop them and ask them, what is your training to be talking, to be giving me this opinion? Why are you saying this? What's the point? So same goes true if you're listening to podcasts, if you're going to seminars, if you're reading books, if you're working on workbooks. Please make sure that the person who is helping you work on your thoughts and emotions has some mental health training, please. Okay. So Samantha's saying, yeah, check credentials when you see a professional. Absolutely. So in closing, what I'll say is this. I'm gonna do more and more of these as we lead up to the holidays. But whatever negative emotion, whatever negative feelings you're feeling because it's the holidays, accept them, work on them, make it okay that you're feeling what you're feeling. Hating yourself for feeling what you're feeling is only going to compound negative emotion with more negative emotion. And no, when you add negative to negative, it does not become a positive, okay? It doesn't. It doesn't. It actually compounds it. Okay. So if you're feeling negative emotion, you have to accept it and work on it. So I've got a comment from Ivan. Scott Peck, I think, said mental health is commitment to reality at all costs. The way I understand it is to see reality as it is. Sure. But again, Ivan, seeing reality for what it is takes work. So absolutely. I would imagine that what Mr. Peck or Dr. Peck or whoever the person is talking about is you have to accept all of reality. This is what my live streams are all about. You have to accept the negative emotion. You have to accept that Ivan may not be feeling good sometimes, and that's okay. You have to accept that maybe Ivan or whoever, Alexander or whoever, Samantha, can work on that. So when you say accepting reality as it is, remember, reality is a mental construct many, many times. We are constructing our own version of reality multiple hundreds, thousands of times a day based on what we have gone through. Yeah, and Samantha saying yes, but it can be stifling. That's for damn sure. So great, Ivan saying I agree, and Ivan, thank you for your comment. So absolutely, but like Ivan, what I've found in doing this work for over 20 years is people don't like accepting negative emotions. We don't have that kind of culture. We don't have a culture that says, hey, look, it's okay to be depressed. It's okay to be anxious, but you got to work on it. What does our culture tell you? Maybe they say, well, it's okay to be depressed, but take this pill to kill it. Take this antidepressant, get it out, painkiller. I mean, think about the opioid epidemic, and I got to run here, but think about the opioid epidemic. Painkillers, kill the pain. You have prescribers, you have medical people prescribing painkillers, telling you, oh, no. Don't wait to feel the pain. Don't wait to feel the pain to take the painkiller. Oh, God. I mean, that is the worst thing you can tell somebody. Don't wait to feel the pain. Why do I feel that's the worst thing you can tell somebody who's experiencing chronic pain? Is because you have to learn how to deal with some pain. Okay? We have to learn. Now, I'm not talking about chronic pain on the 8, 9, 10 where, you know what I mean? It's just debilitating. I'm not talking about, here's the bell curve. Not talking about the outliers, talking about the people in the middle. Please, if you have prescription privileges and you're telling people don't wait to feel the pain, take the pain, you are contributing to the epidemic because people will then keep taking the medication to avoid the pain. And the next thing they know, they're addicted. Okay. So yes, exactly, Ivan, to escape from reality. Exactly. And people that want to escape from reality because they don't know how to deal with reality. They don't know how to deal with negative emotion. We live, like Samantha was saying before, We have this stigma associated with mental health, mental illness. People live in shame. Angie was saying that people are afraid to show weakness, so they keep it in. And the next thing you know, they're feeling like they're dead inside. So last question, human being. What's up, human being? Thanks for coming back. Did feeling anxious cause release of stress hormones? Absolutely. Absolutely. Anxiety is part of that fight or flight mechanism. So stress, and I'm going to talk, and like I said, Friday night, we've got a guest coming on, Dr. Nick Fortino, professor at a major university who has done a lot of research. He's going to give us that end. Last time he came on, we had a great exchange. But absolutely, it releases a stress hormone. And like Alexander said before, it's a circle. So let's say, and this will be the final comment for the night, did feeling anxious cause a release of stress hormone? Right. But let's look at it in terms of a circle. So let's say this is where the circle starts. You start feeling anxious. So your body starts releasing stress hormones associated with that anxiety, because your body doesn't friggin' know if something's stressing you out in here or out here. Now, that's the amazing thing about the brain. The brain a lot of times doesn't know the difference between what's inside and what's outside. That's why when we have dreams, that's why a lot of people believe it. That dreams are not in your brain. It's some sort of alternate reality. It's a whole nother show. But so here's a circle. You release the stress hormone, then that causes you to feel more anxiety. Then you release more stress hormone. And if you're not burning off that stress hormone, that adrenaline, which, adrenaline is a stress hormone, I mean, think about it. You get anxious. What is Neanderthal man get anxious? Something's about to eat me. Something's about to attack me. Something's about to kill me. Run, or fight. But a lot of times we don't do either of those. We don't fight. We don't flight. But all those stress hormones are just building up in us. So yes, it then becomes something that you need to deal with. You need to identify. I'm getting off on a whole nother topic here about how to deal with anxiety, which is fine, but anxiety needs to be disputed. If you think about anxiety in terms of identifying what I'm anxious about and identifying where that threat is that internal or external to me? So we'll deal with that on another show, but thank you for your questions tonight. Ivan, good to see you. Samantha, human being, Alexander, Angie, let's see who else chimed in. My brother from another mother, Fernando, all of you. And I didn't mention you. I apologize. Penny, thank you, Penny. Please share these broadcasts, people. Okay, please. If you're catching this on YouTube, Twitter, or Facebook, please subscribe to whatever platform you caught this. Why? Because they will then put these videos up there more so you can see them. That's the way it works. So please subscribe, share them. And the last thing I'm leaving you with, I'll be on Friday night and we can talk more about this. But if you're depressed and anxious or worried about the upcoming holidays, work on it. Okay? Don't hate yourself for how you feel. I'm not saying love yourself, but accept how you're feeling and work on what is causing you. If you're in a position where you're being forced to take care, Samantha, thanks for all your comments. If you're in a position where you're being forced to do something you don't want to do, maybe it's time to say, look, I'm just not into this today, whatever. But the main thing is accept how you feel and work on it. Okay, people? One more reminder, tomorrow, Friday night, Dr. Nick Fortino is going to be on. We're going to be talking about all kinds of things related to stress, positive, negative, how to deal with it. You're welcome, human being. Cool. Come back Friday night. Thank you for your comment. Please share this. If you can share this video once it's posted, it would be a great help because it might help somebody who's struggling. We all have a degree of mental illness, people. Everyone has a degree of mental illness. We have got to start accepting that and working on that. There's nothing wrong with it. Okay? So hope everyone has a good night. I'll see you Friday night. Feel free to send additional comments to me through my website, through anything you want. Licensedpsychology.com, Dr. Stephen Walker, drstephenwalker.com, a whole bunch of other ones. But if you just type in Stephen Walker, psychologist, you'll come to my website. Okay. Thanks again for tuning in. Peace. Feel free. Accept your mental illness. Work on it. I'll see you Friday night.